Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. Dr. Taylor Soderberg, MD, PhD, to the show. And Doctor is a licensed physician and a PhD in integrative physiology. She received her MD and PhD degrees from University of Colorado and Schloss School of Medicine. She completed her internship in pediatrics through the combined Boston Children's Hospital, Harvard. Taylor then transitioned from academia to become the medical director of Tiny Health, the first microbiome testing company to offer testing for all ages, including infants. Dr. Soderberg found inspiration to study health during her time as a teacher in Chicago public schools and as a Teacher for America Corps member, Amgen Scholar. Hope I got that right. Currently, she is an independent microbiome specialist and consultant, working with both individuals on their microbiome wellness and as well with companies with a mission to bring cutting-edge microbiome research into their products. Welcome, doctor. That was a mouthful, that bio there. Wow, you are.
I know. I was like, that sounds like a lot of stuff. How many years have I been on this planet? So I guess I'm
My
just proof that you
goodness.
can do a lot of different things in the time we have here.
And you're so young. We're not going to ask you your age, but you look very young. So very impressive.
Finding the
Uh,
right passion in life, I think, keeps you looking happy, which keeps you looking young. So I'm going to attribute it to that.
okay, great. All right. So I'm going to go ahead and just dive right in here. So if you can, tell us a little bit more about your background and what led you, what made you decide to go down this path with a PhD and an MD to really kind of go down the functional and integrative medicine path?
Yeah, I love that question. So I would say the biggest driving factor for me that I found just, I've done all these different things in my life and I've realized that I'm just so drawn to building bridges between two like opposite ends of the spectrum within a field. And so that's why I did an MD and a PhD. That's all about health and science. And on the PhD side, you have the research and the discovery in the lab that are very, very focused, narrow, and eventually, hopefully, that goes to the other end, which is the working with people and treating humans and working with individuals. And so I got the MD and the PhD and have been trying to figure out how to build that bridge. And I've always been drawn to natural remedies, I'm really surprised that we taught me about this earlier. When I was looking for research in undergrad, I said, I want to study plants. Nobody told me about herbalism. I didn't realize that was even a thing till later in life. And so I've just always been drawn to, I think, the earth and nature and how do we utilize the resources around us to be healthy. And then, got funneled into the kind of conventional medicine path, which I'm so grateful for. I got to learn so much, meet so many incredible people, and I learned how to take care of just really sick kids, which is devastating and also just so amazing to be able to learn how to do that type of medicine. And I just found that over time that we were just it was such band-aid approach, which when you're really sick, you got to put some band-aids on first. Like you got to stop the bleeding, hopefully not literally, but metaphorically. But I just found that there was what that why. It was always why, how, and I realized that a lot of the answers to chronic health issues was lying more in discovering root cause. And I would say the people who are best trained to work at that level is people who are trained in functional integrative practices. And so I see this now as like another bridge that I want to gap of conventional medicine and functional integrative medicine and building that bridge so that we know how to utilize our colleagues on each side. What are the resources that we can learn from each approach to health? And so yeah, that's sort of how just another bridge that I found between two sort of approaches to a similar practice.
Got it. Can you share a story about a patient whose life was significantly improved using a functional or integrative approach? I know you said you're more doing consulting now and not so much working with patients currently, these functional approaches. Can you give us a story about that?
Yeah, absolutely. And I would say, even though I don't work as much with individuals now, occasionally I still do, but I would say that doing this similar work with practitioners and teaching the teachers has allowed me to reach indirectly so many more patients. And that's
Absolutely.
why I love teaching the teachers, because that indirect impact that I get to have on, it's just exponentially growing the use of these types of tools. Um,
Absolutely.
but individually, I would say that the use of microbiome testing, especially in the pediatric population, is a revolutionary game changing technology. And I have seen kids who have gone from, their parents describe them as burn victims level eczema, just so intense, terrible, nothing seems to work. And then they look at the microbiome, and it turns out that in the gut, there's so much inflammation, lacking beneficial bacteria. And you can put steroid creams on, you can do all the things possible to try to dampen down the inflammation. But if you're not getting rid of the root cause, you're just going to be stuck in that cycle indefinitely. And so getting the access to microbiome data and then utilizing a high quality probiotic, which is the probiotic space has just been so incredible as well right now. I think that with the knowledge of the microbiome, it's really forced companies making probiotics to have significant science backing, really develop the most amazing strains, the right combinations. And so I think that the probiotic industry is really being asked to step up and make sure that they are so high quality and research backed based on the amount of microbiome research that's coming out. And so I think the combination of access to microbiome testing in the pediatric population, plus really high quality supplements that can be used to help correct imbalances, that combination together, I've these parents say nothing has helped, and within a few short weeks, the microbiome in kids can change in just a few short weeks. Their kids 90% improvement in their skin, and that's why we do this, is for those moments for parents and for kids who are experiencing just these seemingly unrelenting immune issues.
I love that. I work with another doctor that works with peds with immune issues, and I often call him the doctor of last resort
Yeah.
because by the time parents have gotten to him, they've seen between 7 to 9 doctors, and
Mhm.
they're just so frustrated and they're
Yeah.
so scared and sad, and he treats the same way you do, and it's just amazing, and within a couple of weeks or a couple of months, these kids' lives have transformed, so that's so awesome.
Yeah.
I can totally see you, like, training other pediatricians on this and how important this knowledge is and just bringing change to so many millions of children's lives. That's amazing.
Yeah, and that's that bridge building of, I think the microbiome is such an amazing area of research and practice right now, because it's truly one of those fields that is really, I mean, gut health has been such a focus for integrative practitioners since the dawn of time, because Hippocrates, the one who said all health, all disease starts in the gut. And I know functional integrative practitioners have really been focused on that in their practice for a very long time. And I would say conventional practitioners, the research is getting to the point that it sort of is crossing that threshold into making its way into conventional medicine training. And so I think this is a really cool area where we're all coming together, and the conventional docs who are open and eager to learn are learning from their colleagues who have been working in this space for quite a while. And I find that the microbiome is one of the coolest bridges between conventional and integrative medicine. And I think that as long as people stay open to learning and realizing probiotics, food, these different types of supplements really can be used as medicine in healing the gut and getting to this root cause. And so I'm just so excited to see how the, these practices change in the next couple of years.
And I love that you shared that because, conventional training for MDs and DOs does not include a lot of these types of nutritional and microbiome
Hmm.
test, training. And it's going to take MDs like yourself and other MDs and more MDs to say, you guys, you got to incorporate this
Hmm.
before the education system will change. But you
Hmm.
guys kind of you had to go outside the system, right? You had to go, you had to become an outlier, an outcast in many ways to pursue this type of medicine. But now that you guys are seeing the success and have the data to be able to go back to your colleagues and the schools, especially, are the ones that need to hear it. And so that's really exciting that, you're passionate about getting this education to other physicians. I love that.
Yeah, and I think too, just like in the same way, and when you're in a specialty and you call a consult for another specialty, I love the idea of conventionally trained physicians knowing when to call, making friends with, collaborating with, and knowing integrative practitioners. And if we understand where each of our expertise lies, I'm not saying everybody has to know everything. As much as I want physicians to have better nutritional training, I mean, I think that's a must. They're never going to be the full experts in nutrition because people who are nutritionists,
Right.
dietitians, they're going to be the experts. And the more that we understand where our colleagues are experts and build that comfortability of talking to each other and utilizing these different resources, that's just going to unlock a whole, that's where a lot of, I think, patients will stop feeling so frustrated because it won't be this, oh, it was only once I left conventional medicine that I was able to get the help I needed. People should be able to utilize all different types of approaches to healthcare to truly get that holistic approach. And so I am so excited at the idea that microbiome is going to be bringing so many different types of people together.
I love that you shared that. I think that's really, I've never heard anyone who say that, but I think that's really important. I say that in marketing all the time. Like, it's impossible for anybody to be an expert in everything, right?
Hmm.
So if I want somebody to be an expert in Instagram, I find somebody that's all they do.
Hmm.
If I want somebody to be an expert in building websites, I find somebody that's all they do, right? I
Hmm.
could I do all of it? Yes, but it wouldn't be done well. So yes, when you're saying the same thing in medicine, like, yes, when you get your MD, you do your rotation on all these different modalities. And yes, you know a little bit about a lot, but you're
Hmm.
really not an expert in everything. And
Hmm.
so, but in your past, when you were utilizing these, being willing to talk to your colleagues and have this collaboration. I'll connect you with a functional medicine doctor after the show that has done exactly that. He's built a network of functional and integrative medicine providers. They get together once a month and they talk and
Hmm.
they refer each other, patients, clients, whatever, because they know that you're going to be better going with a microbiome specialist if it's a microbiome issue, or you're going to be better going with if somebody like Dr. Hirsch, we had him on the podcast. He specializes in chronic fatigue. Nobody's going to know chronic
Hmm.
fatigue better than this guy, right? So yeah, I love that you shared that, and I think that's really cool because I think sometimes doctors, yeah, I can even say, to my husband he's a radiologist, went to school for 15 years. They're kind of, I think there's this perception that you're supposed to know everything.
You took the words right out of my mouth. I was just going to say we are trained to be the person who has all the answers. And I think we need more training in how to say, I don't know, but I do know someone who can help us get to that answer. And
Right.
that's really scary because you have to be able to people are trusting you with their health. And so the idea of sharing that you might not know something, especially in this era where people are getting so educated on the internet, they're getting access to direct to consumer testing, which I'm a huge fan of. But I also think it's really important to share that with your providers because they're going to be able to help you get to understand your results on a deeper level. But I mean, it's scary to have someone come into your office and say, what does this microbiome test mean? What is it telling me? What do I do? And to have to be in that moment and be like, I don't know. I think a lot of people's instinct, unfortunately, is to say, oh, that's not legitimate, or we don't do microbiome and conventional fact. And I think it comes from a place of, if I don't know it, if I didn't learn about it in school, then it must not be legitimate. But in reality, it's just a very emerging technology that is very research backed. And so I hope people will stop dismissing things that they don't know and take that as an opportunity to learn enough about it to know who to reach out to and to understand the basics of it, to know, when to refer to someone else. And so I think it's about getting enough basic knowledge that people don't get this sort of defensiveness about somebody bringing something to them that they don't know. Because
Agreed.
we're all getting educated a lot faster in this era. We've got a lot of emerging technology. There's no way you can expect people who went to school even 10, 15 years ago to be up to date on the newest thing that's coming out. And so I think it's just everybody has to have some grace, but also openness to learning about these new amazing tools that are just coming out like rapid fire.
Yeah, I love that. Real quick personal story that I never do this because this is all about you, doctor. But, my husband's a radiologist. And when we met, he had a lot of GI issues and, heartburn and, reflux and all this stuff. And, I'm a layman. I don't know anything about medicine. Okay. But I was like, maybe we should try organic food. And he was like, okay, well, yeah, that's fine. Let's try it. So I went to Whole Food and I bought like organic everything that he would normally eat. And like
Mm-hmm.
literally in 2 weeks, all of his reflux and GI issues were gone. And he was like, I'm like, how do you not know this? And he's like, I didn't learn anything about nutrition in med school. So
Yeah.
anyway, back to you because this show is
Yeah.
about you. But
No, I think
I just want
it's
to bring
such a
that
good
layman
example.
perspective to everyone to, and my husband, people tell me all the time that radiologists are some of the smartest doctors, right? They have to know every part of the body. And he is,
Mm-hmm.
he's really good at what he does and he loves what he does and he's a great doctor. But he himself was suffering from something as simple as not eating organic. So anyway, back to you. So I'm sure adopting this approach and saying, I have an MD, I have a PhD, Harvard trained. Now I'm going to go to functional and integrative medicine. I'm sure that there were some challenges, whether it's from your peer groups or your family saying, what are you thinking? Like you've got like this amazing bio, like you could go to, I don't know, you could go to a Cleveland Clinic and, demand the highest salary and, be like this amazing clinician. So what has been the challenge that you have faced with, really choosing this route?
That's such a great question. I mean, it's such an exciting space to be in. And I think also being on the science side of things as well, I've never thought about. I I'm sure there are challenges, but I think I've been very lucky that my expertise is in the microbiome that's so popular right now and
True.
so like everybody's aware of it, from just everyday people, no science, no medical background, to practicing physicians, integrative medicine practitioners. I I feel like I've been so honored to get to be a voice of education in this space that it's just led me to so many different unique opportunities. I consult with a couple, like all different types of companies. I get to meet all different types of practitioners. My time at Tiny Health and getting to be on the business side and helping to be, early on at a company and see it grow. And now it's just taking off like wildfire.
I think
To get,
your timing was right. So
yeah,
you haven't had you
it's
haven't
been
had the
exciting.
challenges. A lot of my guests were physicians for 10, 15 years, before they got into functional medicine, and all of their colleagues were telling them they're crazy, to go be going into this type of field. I think you being, the age that you are, and you're
Mhm.
right, it's kind of the hot topic right now. So you probably haven't faced as much challenges as some of the other docs we've had on the
I
show.
don't know anything different. And I have to say too, I mean, I feel for a lot of my physician friends. They do incredible work, and it's a grueling lifestyle. Physician health and wellness is a whole other huge area that needs to be addressed. And so I feel very lucky that I am in an exciting, ever changing, I get to do so many different types of things. And I feel very lucky that I get to live this very cool lifestyle, meeting incredible people of all different types of walks of life, and get to be very happy. And so, I really respect my colleagues who stayed in conventional medicine and are doing this incredibly powerful, beautiful work that they're doing. And I'm very happy that I get to do the type of work that I'm doing. And I made the transition pretty early, so I think I just don't really know any different.
Yeah. Yeah, you're one of the lucky ones. So what advice would you give to other MDs or DOs, that are thinking about adopting this approach to medicine?
Mm,
They're thinking about it. They're like, "Oh, I keep
yeah.
hearing about this functional medicine stuff."
I'd say do it. Lean in, definitely go for it. I think one of the most sort of overwhelming things can be, do I have to learn a whole new field of medicine? Because there's a lot of different techniques, approaches, even some philosophies, even just ways that we think about how the body works. Medicine's very this organ system, and functional medicine is all about the whole body and how that works together. And so I would say choose one thing that's piqued your interest and learn about that. So if it's microbiome, which I hope it is, because I think that's the root of all health and disease, then choose it, like maybe even one condition that you work with, and then just dive into that topic from the perspective of what you are working with your patients on. Or maybe you keep hearing about, let's think of another, like the vagus nerve. That's something that comes up quite a bit, and the role of the vagus nerve in health. Then lean just into that and start learning about, watch webinars, read papers. So I think it can be very, unless you want to make the decision to do a full training program, which I think is incredible. But I understand if you spent a lot of your life in school, you're not quite eager yet to go fully back into training. So if you're not ready to take that leap, which is an incredible one, then yeah, just choose one entry point, and then you'll find from there that you'll learn more. You'll learn about the next thing you're interested in. You'll meet colleagues, you'll make friends with people who will also be sounding boards. But I think it's just finding that entry point, that can kind of take the intimidation of learning a whole different approach to health and wellness, can kind of make that a little bit easier to take that first step in. And if you want
I
to learn
love
about
I love that.
microbiome, you can always talk to me.
I love that. Kind of baby steps. And you're right,
Mhm.
because a lot of my clients, who are MDs, have gone into doing the full functional medicine training, and
Mhm.
it's 2 years of nights and weekends, and it's a lot once after you've already done so much training. But what you're saying is you don't have to go, the full Kahuna. You can just start with one area, and I love that because I think that's a lot more palatable and a lot more doable for a traditional doctor that is, in clinic 9 to 5 and going home and doing their notes, and they just don't have a ton of time. So thank you for sharing that. And then the other thing I wanted to ask you, before we wrap up is, What trends in functional and integrative medicine are you most excited about? I know there's a lot of really new and up and coming stuff, and I know you're passionate about microbiome, but you touched on the vagus nerve. What are some other things that you're kind of like, ooh, that looks really cool and exciting?
Hmm. Well, I mentioned this a little bit, but I think I will say it again because I think it's so important. The quality and research backing of probiotics.
Okay.
I think that probiotics is something that's just for a lot of people just pick them up at the store, don't know about the different strains. I think that, a lot of products in the past haven't necessarily done final formulary testing, just individual strain research. And I'm very excited about the quality of probiotics that are going to be coming out and thinking about pairing them with the right prebiotics. I think that the quality and the specificity of probiotics is going to be really cool. And I think especially, companies that are making GLP-1 focus, like promoting GLP-1, I think that there's going to be some really cool gut health hacks almost with probiotics to help people achieve wellness that maybe medicine, like the not needing to turn more to pharmaceutical medicines, which again I have no judgment against, and whatever works for you and works for your patients is wonderful. And if we can again get to root cause with these really high quality research backed probiotics and other supplements as well. But I think that's going to be a really cool change. And then not so much a tool, but I would say the focus on women's health, particularly menopause. That is a huge area that I think I'm seeing the uh, integrative field leaning. I'm seeing it a lot more at conferences. It's being talked about a lot more. And thank goodness, because women have just been understudied, under researched, under appreciated in terms of our symptoms. And so the focus on, I mean, the microbiome in menopause, I gave a talk on it at the conference we met at. There's just so much interesting relationship between hormones and the microbiome, and I'm very excited to see more research in that area and then what sort of support comes following that research. So I'm very excited about that space.
Awesome. All right. Well, we're getting ready to wrap up. If there is one message that you'd like listeners to take away about functional and integrative medicine, what would it be?
I would say one of the biggest lessons that I learned on this journey is that research, publications, research backing is an incredibly important part of learning how to best approach health, wellness, treating diseases. And it is one piece of the picture. I used to think that if there wasn't, you know, multiple different clinical trials on something, that it just wasn't legitimate. And I think that would be the goal, ideally. But I've also learned that patient experience, individual experience, knowledge that's been passed down through practitioners throughout the ages. I think that I gained a much deeper appreciation for the use of food as medicine. And I think that it'd be great if there was more PubMed research studies on some of these approaches to wellness. But I've just realized that lack of that peer-reviewed data doesn't necessarily mean lack of efficacy, and just being open to that. And of course, being safe and not using untrialed, untested approaches. But I really opened my mind to listen to people when they say how actions they're taking are impacting them, and then see if you can piece it together as a practitioner on physiologically why that would make sense. But that is a huge part of health and wellness that I think I just very much underappreciated before I got into this learning more. And I'm definitely still in the learning process, but learning more about this approach to health and wellness.
I love that you shared that because there's a lot of physicians, that I work with that have been using functional and integrative medicine in their practice for, 15, 20 years, and they have protocols that have amazing results. But there's probably not a PubMed research study on it.
Hmm. We don't research spices. We don't research
Right.
herbs.
Right. I mean, it's just I've just been treating patients this way for 15 years and it works. So, yeah, talking to your colleagues, finding out what they're doing, what's working for their patients. I love that. That's a great last way to end the podcast. And then I know you're doing a lot of consulting, especially for other physicians. How do physicians reach out to you? What's the best way for people to reach you, follow you? Can you give us those details?
Yeah, the best way to get in touch with me is through my website, it's
Okay.
drk.com. So pretty straightforward. Doctor is spelled out doctortay.com. And if you want to do microbiome testing or if you want to talk about ways to collaborate together, so I do work a little bit with individuals on their microbiome wellness, but I also I'm really excited about building a practitioner community and doing more training. So if you want to get in on the pilot level of the community, I would love to hear from people and just sort of see what practitioner communities want. Because I can make a bunch of stuff, but I want to make things that are helpful for like what people actually want and need.
Sure.
Yeah, and then
Okay,
really
great.
just any type of work. If you want to do microbiome stuff, just reach out and we'll find something, some way to collaborate.
And then for like social, if people want to follow you and what you're doing, what's the best way? I'm assuming based on your age would be Instagram.
You nailed it. It's Instagram. I'm not TikTok generation. I'm not Facebook. I'm definitely solidly Instagram. Yeah. So
What's your
my
handle?
Instagram is at Dr. Tay Comedy. Again, doctor is spelled out. So little hint, I am also a stand-up comedian. And a little plug, I'm the executive director for a nonprofit called Science Riot. We train STEM professionals in the art of comedy and have them put on incredible shows where it's basically funny TED Talks. The goal is to educate the public on science, medicine, get them excited about the type of work we do, and also to help people with their communication skills because some of us scientists and doctors aren't always the best at talking to people about what we do. And so helping to make that a little bit easier for people. So check us out. We're in Colorado now and hopefully nationwide in the near future.
I love that. I love that you're also a comedian. I think you are officially the first physician comedian that I've ever met. And I saw one of your skits. It was great. So, yeah, check her out, follow her. She's amazing. Thank you so much, Doc, for taking the time to be on our show. And have a great day.